increasing home dialysis rates. So one of the biggest trends, again, in dialysis as a whole is the push towards more home dialysis. And the reason being, they have better outcomes. These patients typically live longer and do better than patients that go to the center or in the outpatient setting. Now, how do you do this? How do you increase home rates, right? Some of the goals are kind of lofty at this point, what CMS wants to do. But I generally do think we underutilize the population that we have, and we kind of have a selection bias as to who we pick to do home dialysis, meaning we pick the highly intelligent or highly involved and say, this person can do home dialysis. But quite honestly, I've gotten patients that you wouldn't think to do home dialysis to do it. And this is where I think you not only have to be a doctor where you're explaining something. This is where I think you have to be a salesman for it. Right? You have to sell home dialysis, and you have to push, and your whole clinical care team has to push to encourage that patient to actually do it. I myself oftentimes say, you know, if I were to do dialysis, this is the type I would do. I would do it at home. I would do peritoneal dialysis. And I explain the reason why, just to have that camaraderie or just that understanding that, hey, this is what I would do.